Have you ever stopped to think about what it truly takes to save a life? For thousands of people across the United States waiting desperately for an organ transplant, the answer often comes down to two simple things: hope and a match. But finding that life-saving match is significantly harder for some people than it is for others. What if the system designed to give a second chance at life isn't working equally for everyone? Today, we're diving deep into a critical issue at the intersection of healthcare, ethics, and societal justice: the urgent need for diverse organ donors and the persistent racial disparities in organ donation and transplantation. This isn't just about statistics, it's a matter of life and death. Here's a staggering fact that elevates the stakes in this discussion. Nearly 60% of people on transplant waiting lists in the U.S. are from minority communities, yet only about 30% of actual deceased organ donors are people of color. This creates a profound gap that has severe consequences. Organ transplantation relies heavily on finding the best possible match between donor and recipient. This involves matching blood types and, critically, tissue markers. These markers, known as HLA, human leukocyte antigens, are often more closely matched within the same ethnic group. Think of it like this: the better the match, the lower the risk of the recipient's body rejecting the new organ, and the higher the chance of a longer-lasting successful transplant. Without a diverse pool of donors that reflects the diversity of the waiting list, finding these crucial matches becomes incredibly challenging for minority patients. This inequity results in longer wait times for minority patients and, tragically, poor health outcomes. Addressing this gap isn't just a medical necessity, it's an ethical imperative to ensure that the promise of organ donation is available to everyone regardless of their background. To truly understand why these disparities exist today, we must look in the past. The roots of these inequities are complex, deeply intertwined with history, culture, socioeconomic factors, and perhaps most significantly, a profound mistrust of the medical system within certain minority communities. Historically, deceased organ donation was significantly lower among Black individuals compared to white individuals. In the 1990s, less than 30% of deceased organ donors came from racial or ethnic minority populations. While efforts have been made to address this, the effects have been mixed. This mistrust isn't unfounded. It's rooted in real experiences and historical injustices. Events like the infamous Tuskegee syphilis study, where Black men were deliberately left untreated for decades, and the case of Henrietta Lacks, whose cells were taken and used for medical research without her knowledge or consent, have fostered deep-seated skepticism. These historical traumas have led many individuals to harbor fears about the intentions of healthcare providers, particularly when it comes to sensitive topics like organ donation. There's a fear that medical professionals may not act in the best interest of minority patients. This context is vital. It helps us understand that reluctance isn't simply a lack of awareness. It's often a rational response based on a history of being marginalized and mistreated within the healthcare system. Overcoming this requires acknowledging the past and actively working to build trust. Let's look at the data to fully grasp the extent of the challenge. Studies confirm significant differences in willingness to donate and actual donation rates among racial and ethnic groups. According to a 2006 study published in the Journal of the General Internal Medicine, comparing African Americans and whites in Ohio, African Americans reported lower rates of having a signed donor cord, 39% versus 64%. They were also less likely to donate their own organs after death, 72% versus 88%, and less willing to donate a loved one's organs, 53% versus 66%. This study also explored the reasons behind this. African Americans in the study reported greater mistrust in the healthcare systems, with lower average trust scores. They were significantly more likely to agree with statements like, "If doctors know I'm an organ donor, they won't try to save my life," 36% versus 26%. The rich or famous are more likely to get a transplant, 82% versus 76%. They were also less likely to agree that doctors can be trusted to pronounce death correctly when patients are eligible to donate organs, 68% versus 83%. Furthermore, the study found that African Americans were more favorable towards providing financial benefits for organ donation, such as money for donating or money to pay for funeral expenses. These attitudes, particularly the mistrust, were found to be independent predictors of willingness to donate. These findings underscore the reluctance is often tied to deep concerns about equity and trustworthiness of the system itself. Now let's look at broader trends over time. A 2021 population-based cohort study published in JAMA Surgery examined changes in deceased organ donation ratios across racial and ethnic groups in the United States from 1999 to 2017. They calculated a donation ratio by dividing the number of actual deceased donors by the number of potential donors in each group. The study found that the donation ratio increased overall during this period. Importantly, it found that Black individuals showed the greatest gains, with their donation ratio increasing 2.6% or 2.6-fold from 1999 to 2017. This increase was significantly greater than the 1.6-fold increase seen in white individuals. American Indian and Alaskan Native populations also saw an increase, 1.8-fold. However, despite these positive trends in targeted intervention efforts primarily aimed at the Black community, the disparities have not been eliminated. The study found that in 2017, Black individuals were still donating at only 69% the rate of white individuals. The gap was even wider for American Indian or Alaska Native populations, who donated at just 28% the rate of white individuals in 2017. Asian and Pacific Islander populations donated at 85% the rate of white individuals. For Hispanic and Latino populations, differences increased over time, with a 4% lower donation ratio compared to non-Hispanic Latino groups in 2017. The study authors noted that this might be influenced by their specific definition of ethnicity and standardization methods. These statistics aren't just numbers. They represent individuals facing higher rates of conditions like chronic kidney disease, diabetes, and hypertension that necessitate transplant. African Americans, for instance, are disproportionately affected by chronic kidney disease and are more likely to reach end-stage renal disease requiring a transplant. The evidence is clear. While progress has been made, significant racial and ethnic disparities in organ donation persist, directly impacting access of life-saving transplants for minority communities. When discussing organ donation, especially within communities where mistrust is prevalent, certain fears and misconceptions often arise. It's important to address these head-on with clear, factual information. A significant fear highlighted in the sources is the belief that if doctors know you're an organ donor, they won't try as hard to save your life, or might even declare you dead prematurely to obtain your organs. To be sure, this fear is deeply concerning and contributes significantly to reluctance. However, it is fundamentally incorrect. The medical teams responsible for saving a patient's life are completely separate from the transplant teams. The decision to pursue organ donation is only considered after all life-saving efforts have been exhausted, and brain death, which is legally defined, has been determined. Medical professionals' first priority is always to save the patient's life. Nevertheless, acknowledging this fear and explaining the strict separation of medical care and donation protocols is crucial for building trust. Another common perception is that organ allocation is unfair, and that factors like race, wealth, and celebrity status influence who receives an organ. The Siminoff study explicitly found that a higher percentage of both African Americans and whites believed that rich or famous were more likely to get a transplant. But nevertheless, the organ allocation system in the United States, managed by the Organ Procurement and Transplantation Network, the OPTN, is based on complex medical criteria designed to be as equitable as possible. Factors that include medical urgency, tissue type match, blood type, body size, and the distance between the donor and recipient, among others. Race, income, and social status are explicitly not factors in determining who receives an organ. While disparities in access and outcomes exist due to the lack of diverse donors and other systemic issues, the allocation process itself is designed to be blind to these factors. It is vital to educate the public about how this process works to dispel these harmful myths and build confidence in the system. Cultural views and religious beliefs often also play a role. While many religions support organ donation as an act of charity, interpretations vary, and deeply held cultural values around bodily integrity can be barriers. Rather than viewing these as counter-arguments to be refuted, these are cultural considerations that demand respect and understanding. Effective strategies involve engaging with community leaders and religious figures to provide accurate information and integrate donation messages within existing cultural and religious frameworks. Addressing these complex disparities requires a multifaceted approach that goes beyond simple awareness campaigns. It means actively working to build trust, provide culturally relevant education, and to engage communities directly. Culturally tailored education and outreach efforts are essential. This means developing materials and messages that resonate with specific cultural contexts and using the languages spoken within the community. It involves leveraging community-based strategies, utilizing trusted spaces like places of worship and educational institutions, and engaging credible figures such as pastors and local leaders. Programs like the National Minority Organ Transplant Tissue Transplant Programs like the National Minority Organ Tissue Transplant Education Program, the MOTTPEP, founded by Dr. Clive O. Callender, have successfully increased donor consent rates through this kind of culturally tailored education and community involvement. Initiatives such as the Community Investment Scheme in the UK have supported numerous projects aimed at raising awareness and changing attitudes among Black, Asian, and minority ethnic groups through workshops and outreach. National Minority Donor Awareness Month, observed every August, is another critical initiative focused on educating diverse communities and promoting healthy lifestyles to reduce the need for transplants in the first place. Building and strengthening trust relationships between healthcare providers and community members is paramount. This requires open communication, transparency about donation processes, and a commitment from healthcare systems to demonstrate accountability and reliability. Addressing implicit biases among medical staff is also crucial. Efforts must also address the broader social determinants of health, factors like access to healthcare, education, and economic stability, as these also contribute to disparities in transplant access. Finally, leveraging mass media and technology, including social media campaigns and online resources, can help raise awareness and create dialogue, especially when combined with interpersonal educational efforts. However, continuous evaluation and adaptation of these strategies based on community feedback are essential for long-term success. In conclusion, the need for diverse organ donors is urgent and critical for achieving equity and life-saving transplantation. While historical factors and persistent mistrust have created significant barriers within minority communities, the disparities remain substantial despite progress. The efforts being made are showing results. The Coronado study, covering nearly 2 decades, shows encouraging gains, particularly among Black individuals, but also highlights how far we still need to go, especially for American Indian, Alaskan Native populations, and in addressing ethnic differences. The Siminoff study specifically gives us valuable insight into the specific attitudes and mistrust underlying lower donation rates in the African American community. Addressing these issues isn't just about increasing donor numbers, it's about repairing relationships, dismantling systemic barriers, and ensuring that the gift of life is truly accessible to everyone who needs it. This is a shared responsibility for healthcare systems, community leaders, educators, and every individual. The power to save a life is immense. By understanding the facts, respecting diverse perspectives, and actively working to bridge the gaps of mistrust and misinformation, we can move closer to a future where hope and a matched organ are available to everyone, regardless of their racial or ethnic background. So what can you do? Get educated, learn the facts about organ donation, the need for diverse donors, and the issues discussed today. Share accurate information with others. Talk about it. Have open conversations with your family about your wishes regarding organ donation. Register as a donor. If you're willing, sign up to be an organ, eye, and tissue donor. This is especially impactful if you are from a minority background, given the critical need for diverse organs. You can often register online or when you get your driver's license. For living donation information, contact a transplant center. Support initiatives. Support community organizations and programs working to address these disparities and promote donation in diverse communities. Advocate for equity. Support efforts to address broader health disparities and social determinants of health that impact transplant access. Every single registration, every conversation, every act of support helps close the gap, and saves lives. Thank you for watching and engaging with this vital topic. If you found this video insightful, please like it, share, and subscribe to help us continue these important discussions about the ethical impacts of science and technology on our society. Remember, the gift of life knows no boundaries. Finally, let's consider some ethical questions raised in this topic. Given the persistent racial and ethnic disparities in organ donation and access to transplants, is the current system truly equitable? What ethical obligations do healthcare institutions and society have to address these systemic inequalities? How can the medical community ethically rebuild trust with minority populations who have experienced historical injustices and ongoing discrimination within the healthcare system? What are the ethical considerations in developing targeted, culturally specific outreach campaigns to increase donation rates in certain racial or ethnic groups? Is there a risk of perpetuating stereotypes or focusing solely on those groups as sources of organs? What is the ethical balance between promoting altruistic organ donation and addressing the expressed desires of some potential donors for tangible benefits for their families, particularly in communities facing economic hardships? It's important to note for this question, current U.S. law prohibits payments for organs. Considering that organ donation is medically based, but the pool of donors is affected by social and historical factors, is there an ethical responsibility to address the upstream social determinants of health and mistrust that limit the diversity of the donor pool?